Doctors on TV. I'm Dr. Barba-Cabodil. And naku, katulad po ng dati, isang mahalagang topic na naman po ang ating tatalakayin ngayong araw. But before we proceed to that, I would like to invite you po to please like our FB page, Doctors on TV. And don't forget to subscribe to the YouTube channel of Doctors on TV. And remember to hit the bell para updated po kayo palagi sa medical information and healthcare tips. You can also watch us to the YouTube channel of UNTV News and Rescue. In our discussions here on Doctors on TV, madalas mong pinapaalala ng ating mga kaibigang doktor na mas madali at saka mas mura ang disease prevention kaysa po sa treatment. Kaya po in today's episode, pag-uusapan po natin ang preventive healthcare na para po sa mga kababaihan.
Preventive healthcare is crucial for women by the time they reach adulthood. Talk to your doctor and allow her to review your medical history, assess your risk for certain illnesses like heart disease, suggest immunizations, and recommend screenings. Keep watching to learn what tests and other measures are appropriate for your age and lifestyle. Our guest today is Dr. Quincy Raya. She's a preventive medicine physician with over 10 years of vast clinical experience and expertise in patient wellness, integrative, and nutritional medicine, and men's and women's health. Dr. Raya trained in anti-aging medicine in Paris, preventive medicine in Dresden International University in Germany, andrology and men's health with Dr. Peter Lim at Gleneagles Hospital in Singapore, and nutritional medicine with the Australian College of Nutritional and Environment Medicine. She also finished the Leadership in Medicine program of Harvard Medical School in September of 2021. Welcome to Doctors on TV. Dr. Quincy Raya.
Hi, Dr. Quincy. Welcome to Doctors on TV.
Magandang araw sa inyong lahat. Thank you for inviting me today. And it's a beautiful day here in India.
Oh, you're in India, Doktora. Okay. Kamusta sa ating mga kababayan po na nandyan sa India, no? And ito, Doktora, no, napakahalaga nitong ating pag-uusapan kasi alam natin, lagi na lang may mga bagong sakit na lumalabas, and of course, yung mga dati pang mga sakit na nag-e-exist na, no? Pero pag inisip-isip mo, naku, mas importante talaga, katulad ng na-mention po kanina, no, mas napakadali nga po at saka mas mura talaga kapag ang pinagtuunan natin ng pansin ay yung tinatawag na preventive medicine, okay? O mag-focus tayo sa preventive care. Pag ba sinabi ito yung mga terms na preventive care or preventive medicine, ano po bang ibig sabihin nito, Doktora?
So, ang ibig sabihin ng preventive medicine is, this is the type of healthcare that you go to your doctor so they can prevent disease or prevent the progression of disease. So, for example, you have a family history of breast cancer. Mas maiging ma-advise ka ng maayos, ano ba yung mga tests na kailangan mo para hindi ka magkaroon ng breast cancer, or kung magka-breast cancer ka man, we will catch it earlier.
Mm-hmm.
So, it includes family history or genetic predisposition, environmental factors. It includes definitely our lifestyle. What do we eat? Do we exercise? Naninigarilyo ka ba? Or gumagamit ng mga substance na di natin dapat gamitin? So, it's a very wide scope of healthcare.
I see. So basically, ang pinag-uusapan natin dito pagpigil, ano? Okay, so either pigilan mo magkameron ka ng sakit or pigilan yung progression nga, ibig sabihin paglalapan ng mga sakit. Okay, so ibig sabihin dito papasok yung magandang lifestyle. Okay, so pero bago tayo makarating dyan, Doktora, himayin natin. Usually po dahil ang pinag-uusapan natin ay preventive, medicine po sa mga kababaihan. At what age po ba that a woman, should start seeking preventive healthcare? Ganong kaaga po?
So before I answer that question, Dr. Sarah, first we have to look at our lifestyle.
Mm-hmm.
Kasi there's no generic rule to that. So for example, if a woman is medyo overweight at 20 years old, or smokes, or has a sexual lifestyle na kakaiba, we have to start in our 20s. So, if a young female has those characteristics, those conditions, we should start at least checking our blood pressure when we're 20, getting a pap smear. So, at age 20, if you have those 3 conditions, dun tayo magsisimulang mag-test. Moving forward, okay, at age 40, mas maiging mag-test tayo ng blood sugar, ng cholesterol levels natin, because although hindi pa nag-a-appear masyado ang diabetes at high cholesterol at hypertension at 40, but it will be starting there. So, di ba may tinatawag tayong pre-diabetes, konting taas lang ng blood sugar, konting taas ng cholesterol. So, at age 40, it would be good to test for our blood sugar, cholesterol, and our blood pressure. So, etong tatlo, pag meron kang 1 out of 3, or 2 out of 3, or 3 out of 3, the more you have 1 of 3 of this, the higher your risks are for what we call metabolic syndrome. So, metabolic syndrome is a risk for stroke and heart attack. So, bago pa tayo magkaroon ng stroke or heart attack, of course, ayaw nating mangyari yan, di ba?
Of course.
Makikita naman natin na pag yung blood pressure mataas, yung cholesterol mataas, at yung blood sugar, tataas yung risk for stroke at heart attack. Stroke and heart attack should not happen to smart, intelligent, and aware women. Kasi yun lang naman yung titingnan mong tatlo eh. And as you mentioned kanina, hindi siya mahal. Mag-BP ka magpa-BP ka sa kilala mong nurse.
Yes.
Diba? O doktor, magkano ang blood sugar test? 150, 200, cholesterol test, maybe 1,000, yung complete lipid profile na tinatawag natin. Sa halagang 2,000 pesos, kahit once a year, malalaman mo na kung may risk ka sa heart attack or stroke.
Ayan, okay. So tama, doktor. So basically, ang pinag-uusapan natin dito, wala talagang concrete age kung kailan dapat mag-start. Lalo na kung kunyari, mas maganda na ang lifestyle mo talaga from the very beginning is very healthy, okay? And syempre, doktora, basically po, kung mas naabuso yung katawan, that's when mas maaaga na dapat kang mag-umpisa ng monitoring para makapigil o mapigilan ang pagdating or ang onset ng iba't ibang mga sakit katulad yan ng na-mention yung kanina, yung metabolic syndrome, no? So, doktor, ito question di ba minsan meron mga, dahil babae ka lang talaga, meron ka na at least mga predisposing factors. Ano kaya itong mga to, doktora, na parang wala, babae ka, kasama talaga yun sa mga risk factors na meron ka, kung kaya dapat mas bantayan mo? Ano po kaya itong mga ito, doktora?
Okay, kung early yung menstruation mo, you are at higher risk for uterine and breast cancer. If you smoke as a female, mas higher yung risk mo for heart disease. Okay? So, in sexual lifestyle, you are at higher risk for cervical cancer. Wala namang cervix yung men, but they can also get other types of cancer in the genitourinary area. So, balikan ko lang yung earlier, no? Those are the risks, but we're looking at also 2 age ranges here. When we hit 40, although nagsisimula ang hypertension, risk for hypertension, diabetes, at high cholesterol, moving forward, kung may family history ka ng breast cancer, ovarian cancer, it would be a good age starting 40 na magpa-breast ultrasound every year and transvaginal ultrasound. And ultrasound has no radiation, di ba? Wala siyang risk of any cancer or exposure to radiation. And I'll repeat, because Filipinos are very either takot or price sensitive, you know? I always tell my patient, huwag kang matakot sa test, matakot ka sa cancer. Because nang sinabi mo nga earlier na it's cheaper to prevent disease than to treat disease. So, let's talk about costs, right? In Manila, makakapag-transvaginal ultrasound ka ng mga 1,800 to 2,000 pesos. Anong makikita sa transvaginal ultrasound? May bukol ka ba sa uterus? May bukol ka ba sa ovaries? Transvaginal ultrasound is a very good, cheap screening test for cancers of the ovary and the uterus. So, dun pa lang, dapat hindi na tayo abutin ng stage 3 or stage 4 cancers in that area. 2,000 pesos, you will already know. Now, for breast ultrasound, it's about the same price, right? So, for that, You do your breast ultrasound, walang radiation doon, hindi siya invasive. Malalaman mo kung may bukol ka sa suso. Now, natatakot tayo alamin ang katotohanan kung may ganyan tayo. Pero pag nagka-cancer ka, mas malaking problema yon if it's in later stage. For us doctors, the earlier we know your diagnosis, the more treatment options you have, there's better lifespan. And as I mentioned, 4,000 pesos, non-invasive, malalaman mo kung may cancer ka, mas maiging malaman natin yon ng mas maaga.
Tama, doktora, no? I'm with you on that. Kasi yun yung napansin ko, madami mga pasyente ang takot na takot. Tapos eventually, pagka may mga simptomas, kasi alam natin, di ba, doktora, usually bago maging symptomatic or may ibig sabihin ng symptomatic, may nararamdaman na o nagpapakita na ng senyales na may cancer pa lang isang pasyente. Usually po, pagka mga later stages na po, hindi ho ba? Pero pag ito nga katulad ng sinabi ni doktora na from the start, talagang nagpapagawa ka nitong mga screening test, basically nalaman mo na kaagad at an early stage. So, kaya lang dahil natatakot tayo, ayaw nga natin ipaggawa itong mga gantong klase ng eksaminasyon. Nangyayari kung kailan huli na, hindi mo na mahabol yung pasyente o kaya kumalat na sa iba pong mga sistema sa katawan na parang gagawan mo rin naman pala talaga, ilalaban din pala talaga din ng buong pamilya. Kaya lang, mas kung kailan lumiliit na po yung chance okay, na mas matagal na longevity ng isang pasyente, yun po yung nakakalungkot, no? Kaya kung napakahalaga po nitong ating usapin at nadami tayong natututunan dito kay Dr. Quincy, no? Pero ito, doktora, siguro, ano pa kaya yung mga iba pang mga hakbang, no, na dapat gawin po para maiwasan na magkaroon ng mga sakit na ito, no? Bukod pa ho dun sa marami nang na-mention nyo. Pero bago nyo po sagutin yan, Doc, mag-short break po muna tayo. Wag po kayong aalis mga kasambahay dahil magbabalik po ang Doctors on TV. Everyone, nagbabalik po ang Doctors on TV with Dr. Quincy Raya, and we're talking about preventive health care, which aims to promote health and prevent diseases. Preventive care involves evaluation of health risk factors, the use of screening tests, and immunizations. So our next question for Dr. Quincy is, Doktora, what tests and screenings are recommended for women from different age groups? Alam ko may na-mention na kayo mga ilan, pero baka may mga gusto pa po kayong idagdag.
Early in your 20s, 30s, I would recommend just test for your blood pressure and a pap smear. When you hit 40s, I would test for your blood sugar, cholesterol, and moving forward, I would do a breast ultrasound and a transvaginal ultrasound. So, if you have strong family history of, say, colon cancer, I would recommend that you undergo colonoscopy when you're in your 40s. Now, moving naman forward to menopause, right? Okay. So, menopause is when our menstruation stops as women and we don't become fertile anymore. And there are diseases related to menopause which happens around 48 to 52 years old. Hindi natin to masyadong tinitingnan sa Pilipinas, but osteoporosis, we have to look at that. And there's a test for that called the DEXA scan. Nagagawa lang ito sa malalaking ospital. Bakit natin titingnan ng osteoporosis? Because habang tumatanda tayo, we're at risk for fractures. Pag na-fracture ka na hip fracture, at risk for shorter lifespan ka na. Pababa na yung health mo kasi di ka na makagalaw, madidepress ka pa.
So, diba? Nagsa-start pagka nagkaroon na ng fracture and then, bedridden muna ang and then, minsan nagsa-start na yung mga bed sores. Tapos nag-uumpisa ang sepsis. Diba dyan na nagsa-start? Kasi may the aunt of my mother that's what happened to her. Yun nga, pag upo pa lang na sumala, doon na po nag-umpisa. And sayang kasi she was like 90 plus years old then. And then, mahirap nang habulin, no? So, yun po. And then, as you were saying, Doktora.
So, at that age, if nawalan ka ng period, it would be good at that time na magpa-bone DEXA scan. Makikita mo yung density ng bone mo and you can start preventive treatment for fractures in the future. So there's where you take your calcium, vitamin D, and there are medications out there that you take once a month, starting from when you lose your period for the next years, and it's very safe so that hindi ka magka-fracture in the next 10, 20, 30 years. It's affordable and it's easily available in the Philippines. And of course, between you and me, Doctora,
Yeah.
you know, we do bioidentical estrogen and progesterone.
Identical hormone replacement therapy, no? It's very
Correct.
important. Si Doktora, maganda na i-reiterate yan natin na na-mention niya, I like what you said, no? Yung about the hormones. Kasi, syempre, like for example, di ba yung mga tao nga nagsa-start din ng calcium tsaka vitamin D kung kailan menopause na. Pero, yung sinabi mo, maganda yung Doktora na pwede nang umpisahan yan, di ba? Early on. Hindi mo na iintay yung humupok pa yung mga buto mo before you even start taking these medicines, no? And yung sa hormones, Doktora, we have to understand po mga kasangbahay that these hormones have protective effects po sa ating mga sistema. Kung kaya nga kapag nag-umpisa na pong mag-menopause sa mga kababayan at sa lalaki naman yung andropause na tinatawag, yan na po, dyan po nag-uumpisa yung mga iba't ibang sakit katulad ng mga na-mention ni Doktora Quincy kanina. Doktora, di ba? And Doktora, how about po yung mga immunizations that can prevent illnesses? Meron po kayo, baka meron kayong mga gustong ibahagi that can help our viewers?
Yes. So for women's health, there's one particular immunization, no, that we can give against HPV or human papilloma virus. HPV is the cause for cervical cancer, vaginal cancer, anal cancer, and it can also cause head and neck cancer. So just getting this vaccine, which is given 3 times in 1 year, can prevent dozens of cancers. And with that, alam mo yon, Dr. Sar, pag nagpabakuna ka against HPV, you also protect your sexual partner from these cancers. As long as faithful siya sa'yo, di ba?
Oo, syempre, opo. Saka hindi, we have to understand yung na-mention niya human papilloma viruses. Napakarami po kasi niyang strains, okay? And kasama
Yes.
mga bakunang ibinibigay, ito po yung mga most common causes, most common ones. You just have to discuss this like kay Dr. Quincy, yung mga po nasa mga preventive healthcare po, no, na mga medical professionals para at least alam niyo po yung, kasi magkakaiba rin ng mga brands, di ba, Doktora? But which one is, okay, best for you. Usually naman kasi mas maraming states, medyo mas mataas ng konti ang presyo, but like what we said a while ago, mas mura pa rin po mag-prevent ng diseases rather than kapag nagkaroon ka na especially ng mga cancer, na kung madugo po yan, iba't ibang aspeto po ng ating buhay ang talagang apektado. Hindi lang po financial.
Tama ka dyan, Doktora.
Opo, ayan. At syempre, hindi po mawawala sa ating talakayan ang lifestyle changes na dapat gawin to reduce our risks of getting sick. Nako, yan naman po yung pag-uusapan natin with Dr. Quincy Raya. Maya-maya lamang po sa pagbabalik ng Doctors on TV. Hi everyone! You're still watching Doctors on TV. Nako, at sa ating pagpapatuloy, no, Doktora, ito, dahil we're talking about preventive healthcare, no? So na-mention na natin kanina kung gaano kahalaga ang pag-maintain ng mga lifestyle, okay po, and habits, no? So ano po ba yung mga changes na ito na dapat gawin, okay, ng isang individual regularly, no, para mapigilan po ang pagkakaroon ng mga iba't ibang sakit?
I think our lifestyle choices really play a big role. So, we have to look at our diet. Walang isang diet na good for everyone. But I think one hard fast rule is to avoid sugars. Yung mga soft drinks, cakes, bread, and higher intake of vegetables. But still, we need a balanced diet of proteins, carbohydrates, and fats. Avoid sugars. That would be really one very valuable advice that we can give to our patients. And of course, it would be good to be able to do 30 minutes of exercise 5 to 6 days a week. So that would actually already improve your metabolism and help burn the sugars and the fats that you ate for the day.
Yeah.
And of course, you know, sinasabi nilang hindi importante ang sleep. Sleep is actually very important. Very relaxed, restorative 7 to 8 hours sleep before midnight. So, yun kami as preventive medical doctors, we teach patients sleep hygiene. So, para rin siyang tinuturuan mo yung patient paano siya matulog ng maayos. And of course, let's avoid smoking, excessive drinking of alcohol, and taking substances na hindi nakakagaling, na hindi maayos para sa ating katawan. And lastly, yung health natin, hindi lang tayo. If we're exposed to substances, environmental toxins, like kung may allergy ka sa dust, allergic ka sa pollen, you have to look at environmental factors too. And that's not just that. Parang toxic people, we have to avoid them and situations. Because, diba, there are people who are toxic to you, your mental health and your stress, diba? Tataas yung stress mo because we have to manage stress. And by the way, Dr. Sara, ang stress nakakamatay.
Okay? I know, okay.
When you're stressed, your inflammatory markers in the body increase. So pag mataas yung inflammation sa katawan because of stressful situations and stressful people, magkakasakit din tayo dyan. Hindi lang heart attack, pati cancer. And of course, we have to find our sense of purpose when we wake up in the morning. Kasi kung wala kang purpose araw mo, hindi ka magiging masaya and have a great sense of well-being at the end of your day.
Oh, that's my favorite line that you mentioned during this episode, Doktora. Tama yan kasi sometimes na kahit may sakit ka na, pero pag alam mo may purpose ka, there's always a reason for you to wake up, no? And, share the goodness that you have in yourself to others. And with that, Doktora, thank you very much. Ang dami nyo na ibahagi po and na-inspire na ating mga kababayan, no? And Doktora, saan kaya pwedeng makipag-ugnayan po yung mga gustong kumonsulta sa inyo?
Yes, thank you for giving me this opportunity. And if you can follow our Facebook page and IG page at the Raya Clinic PH, we also started a YouTube channel. It's called the Raya Clinic, where we share lifestyle choices for a better health and increasing your lifespan. So our motto there is, we'll see you in the next 50 years. Ganon.
Oh, maganda yan, Doktora. Although, yung minsan ang biruan ng mga iba, paano kunyari 80 years old na yung nanonood sa inyo, parang gusto pa ba niya na okay pa siya by 130 years old? But of course, pag maganda ang iyong di ba? Pag maganda ang lagay ng iyong katawan, di ba ang dami nga iba nakaka-survive over 120 years old, no? Yung natawag
yes.
They do stay daw sa mga blue zone areas, no? Yun yung mga mahaba yung longevity po ng mga
Tama. Pero speaking about my family history, both my parents are healthy at mid-70s and my grandmother is turning 95 this year. Of course, alagang-alaga natin yan.
Such a blessing, Doktora. Congratulations. Ako, my parents kasi just passed away late last year. They were laid to rest, no? Together. My father was like 80 plus and my mom was 70 plus. But okay, so and I'm happy to know that your parents, your grandparents are all good, no? And thank you very much for all that you had shared. Doktora, any contact number? Huli na lang po.
Yes, our contact number is 0917-626-9303. And our website is www.rayapreventive.com.
Ayan. Thank you very much again, Dr. Quincy Raya. And of course, looking forward to having you back here in the program. No? Huwag nyo kaming pahihindihan, Doktora. At katulad na nangyari ngayon, I'm sure marami po ulit kaming matututunan. Kasama po ang mga viewers natin. Thank you very much again. So, pinasasalamatan po natin ang Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts which can be used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. So, for inquiries and orders, you may contact 0969-1754231 hanggang 33 or yung kanila pong landline 8824-5217 and 8813-0320. And pinasasalamatan din po natin ang Organic Azay Berry. Support your health with a 100% organic superfood supplement. Organic Azay Premium Blend and Azay Freeze-Dried Capsules, rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients that our body needs to help build stronger immunity against illnesses and help increase your energy. Organic Azay is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. And of course, salamat din po sa ating partner, ang DepEd Santa Rosa, sa pakikiisa po sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Thanks as well to Clinica Figura. So for inquiries and appointments, you may contact 0917-317-7272. And thank you also to Healthy Nom Nom Foods and sa Medical Depot. And muli po, maraming salamat po sa inyong lahat. By the way, I miss and love my parents, no? My missionary and tatay. Muli po, ito po si Dr. Sara Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.